Thanks. Jay Jackson from Volteface, drug policy think tank. Would a Labour government take a health-based approach to drugs by, for example, putting the drugs minister into the Department of Health and Social Care and embracing services such as overdose prevention centres, dimorphin-assisted treatment, drug testing facilities, and expanding access to medical cannabis?
It's a good question, and one I would tread carefully on because it is a cross-departmental issue. I think there is a distinction to be drawn between drug treatment and crime and punishment, and I think we need to look very carefully at the evidence. And I think it'd be good to have a kind of more rational, reasonable debate as a country about this. And I'm kind of, from a health point of view, probably have the easier end of that in terms of thinking about. And it doesn't just apply to criminalise drugs, for example. It applies more broadly to public health in terms of smoking cessation, alcohol addiction, gambling, and a wide range of other sort of public health areas. And I'd be very comfortable kind of really driving that agenda forward through the Department of Health. All I would say on the crime and punishment side of things, as far as I'm concerned, when drug dealers in this country decided to use children to ferry drugs around the country and engage in child sexual exploitation and criminalisation, that for me was the moment that the government should have stepped forward and sought to absolutely crush every drug dealer in the country. And I'm absolutely appalled at the way in which, when you look at prosecutions, when you look at getting people from arrest through to prison for serious organised criminal activity on county lines, people say, oh, the war on drugs has failed. When it comes to county lines drug dealers, I don't think that the war on drugs has even begun.